9 former directors and acting directors at the CDC say current Health and Human Services Secretary Robert F. Kennedy Jr. is, quote, endangering every American's health. That was the headline in a New York Times op-ed yesterday pinned by the former directors. It comes days after President Trump fired the current CDC director, which prompted many other department leaders to resign.
Our health expert, Dr. Coley, is here with us now. So first and foremost, you're tied into the medical community. How are doctors reacting to the change in leadership at the CDC and all of these resignations?
Yeah, we're a little surprised, that's for sure. I mean, his intent is good, right? He says his goal is to restore trust in the public health organization. But the fact of the matter is the instability creates a little bit of unrest, right? Think about it like a ship headed into choppy waters. That's not the time to change the captain, right? What are our choppy waters? The winter season, kids back at school, COVID cases are going up.
Yep. And we're feeling both of our kids have been sick. We had to pull them out of school already. It's week 2, week 3. So talk more about these conflicting recommendations. Who's saying what, essentially?
So one side you have the CDC that says healthy people should not be getting the COVID vaccine. Only older people or people with other health problems. The other side is the American Academy of Pediatrics and the Infectious Disease Society of America saying healthy people need the vaccine. The vaccine got us out of the pandemic. So it's really quite a divide if you think about it. Most Americans don't know what they should do. Most doctors don't know what they should do.
What are the former CDC directors saying? Are they in alignment with the pediatrics and the others that say that you should get the COVID vaccine?
The ousted ones?
Yes, the ousted ones.
Very much so, very much so.
So this is the turmoil.
Yes. In fact, and what's going on here is that the reason the director was fired was because she was not going to sign off on vaccines for healthy people. Now, if you think about who's getting in the hospital with COVID, kids under 2. So the 6 months to 2 years is in and of itself a huge risk factor because those kids have immature immune systems, so they're more likely to end up in the hospital. But the new CDC guidelines say only kids with other existing problems should be getting it. Now, the good news here, ladies, is that there are a wide range of existing problems that would qualify you, such as depression, obesity, being sedentary. These are all problems that would qualify technically a healthy adult who has this condition to get the vaccine. So still about 100 to 200 million Americans out of the 340 million Americans would qualify under the new guidelines. But people are scratching their heads because they're wondering, should healthy Americans and healthy kids be getting this? And I'm curious, are you guys going to vaccinate your children this year?
I used to listen to my doctor.
Yeah, whatever the doctor says. But now I feel like I'm confused. So if I want a COVID vaccine, do I need to say, I've dealt with depression in the past, now I qualify? Seriously, how does that work? Can I go to my doctor and get one?
You used to go to just a CVS and get your COVID vaccine.
Right, and now you have to pay?
So huge issues with manufacture, because obviously if it's not being recommended across the board, then companies aren't going to make as many of them. So there might be supply chain problems. Huge issues with coverage, as you said, because if the CDC is not recommending it, then the insurance companies really earmark to that and say, well, we may not cover it, so you may have to pay out of pocket. And then most of the pharmacies here in Colorado are actually going to require prescription to get your vaccine. So it can't just be, you were at Target, you're at CVS, you just get it while you're there. You're going to need to contact your doctor. So if you're a healthy adult who doesn't have a pre-existing medical problem, you can still technically get it, but that requires a one-on-one conversation with the doctor, requires a prescription, and may require out-of-pocket cost as well.
Okay, so if you jump through all those hoops, which you should, but if you do, and you get that COVID vaccine, does it include the latest strain?
It does.
Okay.
And the strains have continued to change. Now, the good news is the latest strain is still an Omicron descendant, so it's still relatively mild symptoms, which is a good thing, but it's actually being surpassed by another strain coming, potentially Nimbus. Now remember, the more infections that there are, the fewer people that get vaccines, the more infections. The more infections, the more chances for the virus to mutate and become either more aggressive or more transmissible. So it's really going to be every American's personal decision this year. I'm getting it, I'm healthy, I don't have a lot of other health problems, I'm a healthcare worker, so that puts a target sign on me. But a lot of my friends who are in the same age group and healthy are talking to their doctors about getting it this year.
Can we reach herd immunity this year with all this going on?
That's my concern. It's that if all of us decide not to get it, and even before this had happened, 1 out of 4 Americans eligible for updated vaccines were getting them, the COVID ones. But if all of us decide not to get it, we're done with herd immunity, which means definitely more infections, possibly more hospitalizations. And like I said, are we looking again at another variant that makes us sicker, where the antivirals don't work as well, where the vaccines will need to be changed? That's the fear.
Okay, wow, a lot to think about.
Dr. Coley, thank you.